Houston Health Department's Health in All Policies Project's mission focuses on Houston's most vulnerable areas with a high risk of lead poisoning and homes that need remediation. The objective of the project was to effectively collaborate with vulnerable communities with the intention of evolving relationships into a system of neighbors helping neighbors while educating the residents of the health hazards of lead poisoning. With funding and TA support from the National Center for Healthy Housing, or NCHH, and the HIAP Collaborative, this vision came to fruition with the greater Fifth Ward community. This success story will describe the Fifth Ward community's passion and commitment for their neighbors, family, and environmental health in collaboration with the Houston Health Department. The Health Department accomplished their strategy with a place-based approach that targeted a hotspot neighborhood for childhood lead poisoning. To set the scene, the greater Fifth Ward community has a large proportion of older housing stock where 78% of homes were built pre-1978 and are at risk of containing lead-based paint, and a history of lead poisoning where elevated blood lead levels reached as high as 51% in screened children in the past. This initiative heavily relied on active community engagement. Therefore, our project's framework included forming partnerships with local community-based organizations that engage directly with neighborhood residents. The Fifth Ward community members eagerly assisted in networking the health department with community residents to participate in the initiative. The outstanding buy-in from the community was pivotal to the project's success. To better identify the Fifth Ward's needs, the health department used appraisal district data to determine the age of homes and develop a risk map that identifies families that are potentially at risk of living in homes that contain lead-based paint and homes that are lead safe. This strategy also helped identify lead-free homes that had completed the health department's lead abatement program. This approach also informed us on specific areas within the neighborhood that needed our focus, and we could then coordinate efforts with local organizations. To effectively and efficiently provide lead education, we developed a model where community leaders or block captains complete a lead poisoning training workshop. This workshop included topics such as the health hazards of lead and how they adversely affect children, strategies for lead poisoning prevention, and guidance on how to identify signs of lead-based paint in homes and how to refer these homes for lead abatement. The identification and referral components of the workshop included how to confidently identify at-risk homes that may contain peeling, chipping, or flaking lead paint, and basic eligibility requirements for possible home remediation referral to the health department's lead-based paint hazard control program. Furthermore, the community members learned about the available resources regarding lead poisoning. Following this training, block captains were assigned responsibility for sections of their neighborhood. The added support and commitment from each block captain was immense, as each was motivated and well equipped by the health department with maps and data on potential lead paint risk at the parcel level. Each block captain would walk their assigned blocks where they utilized their training, risk maps, and intimate knowledge of their neighborhood. During the block walks, the block captain successfully obtained vital information using home surveys by conducting visual assessments for lead paint, speaking with families to invite them to enter the city's lead abatement program, and documenting these homes to refer for abatement. These referrals were then documented in an internally developed lead hazard housing database to keep track of referred homes and their paint status, to be followed up with by an HHD program qualifier. Following the accomplishments of Year 1, the Health Department decided to expand and replicate the project approach to the Acres Homes community in Year 2. The Acres Homes community shares a similar profile as the Fifth Ward regarding lead poisoning and poverty. Research shows that 74% of Acres Homes residences were built in 1978 or prior, and 28% were built in 1950 or prior. This is a strong indicator of a greater risk for childhood lead poisoning. The original plan for Year 2 was to utilize the same model from Year 1 to address the needs of the community regarding lead poisoning. We developed a lead risk map for the Acres Homes community similar to that of the Fifth Ward and updated the new information into the lead hazard housing database to include Acres Homes residences. While working on creating the lead paint housing map and a lead hazard housing database, the Health Department also contacted Acres Homes community organizations to begin fostering relationships. However, with the onset of the COVID-19 pandemic, new obstacles and challenges led the health department to realize that several items in the original work plan needed a modified approach. While several organizations and community groups had been identified as potential partners, for safety reasons and to maintain social distancing, most of these organizations had suspended external activities and meetings. Given these unforeseen circumstances, with guidance from NCHH and other collaborative partners, the health department decided to shift the focus of the project away from holding in-person training events for the community block captains and instead proposed to create a video recording of the training. This recorded training video would feature the health department's community relations specialist covering all of the same topics that an in-person training presentation would include. This video recording will be made publicly available through the health department's website, and we aim to also have it distributed through email listservs and newsletters provided by local organizations that are sent to the community residents. Through this model that was implemented as part of the Health in All Policies project, the health department is able to connect directly with the block captains who serve as the point of contact for neighborhood residents to remain aware of the challenges that the community is facing, which strengthen these partnerships in a continuous feedback loop. In this way, by helping residents change their homes, the community and the health department are helping to change their lives. Furthermore, the HIAP efforts are still going strong in the Year 1 target community of 5th Ward, with efforts now initiated under the leadership of local community organizations. Together, the health department and these partners are leveraging each other's resources to expand and formalize the block captain system that had been initiated in Year 1. Not only has the work been sustained, but the community itself is taking ownership and growing the efforts even further. The Houston Health Department is excited to accomplish this program with guidance and assistance from NCHH and project funders. This project would not have experienced such a success without their abundant support. The HHD HIAP team will continue working towards achieving a safer, healthier city, one neighborhood at a time. For more information on the Health in All Policies efforts, you can contact the Houston Health Department's Bureau of Community and Children's Environmental Health at 832-393-5157 or 832-393-4634.